Good morning. My name is James. So, this is going to be my video on Parkinsonism. Parkinsonism is basically Parkinson's, but not. It's basically all the symptoms of Parkinson's. Only the difference is it's not a disease, it's a disorder. And it's usually a result of bad medication, which goes back to why I do not like medications. And again, that's just for me. I know that for other individuals, it works better for them. Things do in those categories work better for them. I respect that. But for me in particular, medications do not work well. Those who've watched the last couple videos I made, only bad reactions. Only bad reactions I had from those medications. So I don't like them. Risperdal, and my next video will be on the Wellbutrin. But Risperdal in itself is very, very bad. It's been sued repeatedly for doing lots of damage. I may in the future take up that option. We'll see how things go. But yeah, no, it's a very bad medication. I know for some people it helps. For me, it hurt. Risperdal is bad. Like, really bad. Like, it basically stops your ability to feel. Not sure exactly how to describe that further. It's basically a feeling of zombification. The best possible description I can give is to say that for those that have ever gone through a kind of drug withdrawal, that's what it feels like, but it never stops. It was a very, very terrible experience. I was put on that medication by the doctors in Waterbury Hospital, Dr. Parvis in particular, yeah, did a lot of damage. I was on that medicine for only about 2 months, but even now, well over, almost 7 years now, and it's still lasting. Not as it was, but there's still effects. And when I say effects, let me go into detail. I have body tremors, and it basically is when different parts of your muscles kind of flutter. You could see it. They kind of like move up and down, sort of. It's strange. But yeah, usually that only happens with people that are in a much older age group. I'm 32. It's like, wow. And yeah, that's because of the Risperdal. But that's nothing. I mean, that side effect is nothing. The bad side effect is when my dopamine stops. What is dopamine? Dopamine is the most important neurotransmitter you can have. It's basically the lifeblood of moving. Right now, I'm in a very good state. I feel fine, I'm able to talk and everything's well. When the dopamine goes away, it's like a total dropout. All I feel like doing is sleeping. I can barely even talk. And that's probably the scariest part. It actually affects the voice because you need dopamine to talk as well. I can't stress enough just how devastating a side effect of losing the dopamine in your body is. But I have to live like this now. It doesn't happen as often as it used to, but every couple months or so, I'll go through that, and through the use of different vitamin supplements, I'll have to basically re-energize the dopamine in my body to get going again. That's just how it is. So, how do we treat it? What I do is a lot of CBD oil. I really don't know why the federal government still hasn't fully recognized it yet. It could probably save tens of millions of individuals. But yeah, I use pharmaceutical grade CBD oil to treat it. Um, and basically, it works. It re-energizes the dopamine receptor site areas. That's basically where the dopamine's created in your brain, in your body, throughout the body. Um, it's all part of what's called the endocannabinoid system, but I'll talk more about that in a further video as well. But yeah, the CBD oil helps a lot. And I also take another supplement called L-tyrosine, which is basically uh, dopamine in a pill. It helps regenerate it. And yeah, and that's what I do. That's what I have to do. It's a frustration, all takes time, takes money, takes a lot of money. But yeah, that's how I gotta live. So that's why I always tell people, whatever medications you try, if they work, good. If you're happy with them, cool. But if not, say something. Do something, Not all medications are equal, and a lot of them do a lot more damage than they should. So, that said, those are my symptoms and conditions with the Parkinsonism. I hope everyone has a great day. Thank you, and take care.